Okay, today I'm going to show you how to put on sterile gloves. One of the first things you need to think about with sterile gloves is you're going to look at this packet as if you were looking at any sterile packet. It could be gloves, it could be dressing supplies, it could be instruments. So first of all, you're going to look at your packet and you're going to look at the expiration date and make sure that it is within date. If your packet has expired, it's no longer considered sterile and you can't use it. Another thing you want to look at your packet is you want to examine it and make sure that it hasn't been opened, that there are no punctures or tears. And you can see the gloves through this clear backing, and I can see that there's no water spots or discoloration. If there are any abnormalities to that packet, then it would be considered non-sterile and you couldn't use it. Okay. With sterile gloves, unlike clean gloves, they come in sizes, anywhere from say a size 6 to a size 9, and you're just going to have to find what fits you best. You want something that's snug so you've got good tactile dexterity. You don't want loose fingers flapping where you can't have a good sense of touch. And the principle of sterile technique that we taught you on the first day of class was anything below the level of the waist is considered contaminated. So we're going to have to get our table where we're going to be opening our gloves, and we're going to put that at about waist height. So that looks pretty good for me. And you want to clean off this table because this table holds everything from bedpans to urinals to lunch trays to dirty tissues to dentures. So it can be quite dirty. So you can either clean it off or you can put a clean towel over the table, and that would protect your supplies. Now I'm going to open up my package, and all of the packages start with a peel apart. So I'm going to peel this apart, and I can reach in here and pull out the little envelope of gloves. Now this is size 6, and the sterile gloves are always going to be put in the package like this. We open it up and it looks kind of like a book, and the gloves are going to be packaged palm up with the thumbs outward. And that's going to be important because sometimes it's hard to visualize the thumbs and the fingers, and as long as you have your thumb up when you go to put your hand in the glove, you'll be fine. So I'm going to open this, and you can see that it opens like a book, and we've got several folds. We've got a fold at the top, at the bottom, and then on either side. Okay. When you open these up, the second principle of sterile technique is you don't want to reach across your sterile field. So if I happen to get my gloves backwards, I would not want to do this where my arm would be reaching over the sterile field because I could have hair or skin cells or microorganisms drop onto my gloves. So don't reach over a sterile field. Now I'm going to start to open my gloves. When you open your gloves, if you fold these little flaps back, they have a tendency to want to fold back. And that's what we call the memory of a package. And that can be very challenging to make it easy to open your gloves. So I do what's called breaking the memory. And so when I open this, I just give it a little crunch, and you see that that flap stays open. Same thing there. Now I'm going to reach in up under these flaps on either side, and I'm going to open my gloves. When you open the gloves, once again, we have the memory of these side seams. So to keep it so that the package stays open, if you very gently just buckle that package, it will stay open. Just a little trick that might work for you. Okay, so as we said, it's above the level of my waist. The outer inch, I'm not going to reach across it because that would be contaminating. Thirdly, is the outer inch is considered contaminated. So I can touch this outer inch, but I can't move within that inch. Otherwise, I would be contaminating. Same thing with the gloves. You want to make sure the gloves stay within that boundary. Now, when you put your gloves on, I normally put on my dominant hand first, which is my right hand, and we follow a specific sequence. The first one, we say we pinch the glove, and the second, we scoop the glove. Now, my hands are not sterile, so when I pick up a glove, I have to choose carefully where I pick it up so that I don't contaminate the glove. So I'm going to pick it up by the cuff because that's going to be the inside of the glove. Once I pick it up, I'm going to step back away from my sterile field. If I don't step back, I might brush this glove against the edge of the table and contaminate it. So it's a good habit to take a step back. Now I have to remember to keep my hands above my waist. So palm up, and I'm going to put it in. Once I get my fingers in there, I kind of spread them out and I slide my hand in there. Don't worry about the cuff. Don't fix it as long as it's over the heel of your hand, because we're not doing a sterile procedure with our wrist. I don't like for you to manage the cuff because you risk contaminating the glove. So I've got one glove on. The second one we're going to scoop. So I've got a sterile glove and a sterile glove. At this point in time, I'm going to slide these 4 fingers up under the cuff, and I can use my thumb to get it, and I'm going to pick it up. And once I get my fingers under there, I kind of like stretching out my fingers a little bit to keep that glove from sliding off my hand. I'm going to step back, palm up. Now you notice my thumb. My thumb is what I call hitchhiked out. If I keep my thumb here, which our instinct wants us to grab and pull, this hand is contaminated. So as soon as this hand touches the inside of the glove, technically this whole inside of the glove is contaminated. So I don't want my thumb to be touching that contaminated part. So I'm going to hitchhike my thumb, slide my hand in, and I'm going to do something a little strange just so I can show you. I'm going to pull my glove on up over. Now look what happened. This sometimes happens where you get 2 fingers in one glove hole, finger hole, and that's okay. This glove is sterile, this glove is sterile. And so at this point in time, I can make the adjustments by pulling it out. And there we go. And you have on your sterile gloves. Now I can go ahead and do my procedure. And once I do that, I'm going to take off my gloves. One other principle of sterile technique that I want to point out is you never turn your back on a sterile field. Because if I am getting ready to put on my gloves, but I remember that I wanted something on the table over there, if I were to turn my back, somebody might touch my sterile gloves, a patient might touch them. They don't know what sterile is, or a fly might land on it. So never turn your back on a sterile field. To take off your gloves, I'm going to take them off just like I would clean gloves. I'm going to grasp it at the heel of the palm of my hand, and I'm going to turn the glove inside out, hold it snugly in the palm of my hand, take my bare hand, reach up underneath my other glove, and pull that inside out. And now I can discard my gloves and wash my hands. And that's how we put them